clock for feline maturity starts ticking much faster than most owners anticipate. By the time a cat reaches 4 months of age, she is already capable of reproduction. This is not a distant future milestone. It is an immediate biological transition. The reproductive system of the cat is uniquely efficient, as the act of mating itself triggers the release of eggs. This mechanism makes the probability of conception exceptionally high, turning a standard social interaction into a guaranteed biological event. For a pet owner, this leaves no room for hesitation. The window to intervene is narrow. If breeding is not the goal, waiting even a few extra weeks significantly increases the risk of an unplanned litter. Professional spaying before the 4-month mark is the only definitive way to halt this cycle. Every day spent in uncertainty narrows the options and shifts the responsibility from prevention to management. Understanding this rapid development is the first step in responsible care. It requires a shift in mindset, seeing the cat not just as a companion, but as a maturing individual whose biological timeline dictates the owner's schedule. The choice is binary: manage the biology through early intervention, or prepare for the rapid, inevitable arrival of a new litter. Once conception is confirmed, the physical reality of the pregnancy begins to manifest within the first 2 weeks. A process known as pinking up occurs, where the nipples shift in size and tone. This is the first tangible evidence for an owner to monitor. By the 4th week, the internal changes intensify. Hormonal fluctuations often trigger symptoms similar to morning sickness, which can manifest as lethargy or a sudden disinterest in food. Recognizing these shifts is critical. The cat is no longer maintaining herself alone. She is supporting the development of a litter. This reality mandates an immediate change in diet. Switch the cat to a high-quality kitten formula designed to provide the dense caloric intake required for fetal growth. Increase the daily food volume by approximately 50% to meet the rising energy demands. The transition must be seamless. As the cat consumes these extra calories, the owner must observe the gradual increase in body mass, ensuring the weight gain is steady rather than sudden. This is a period of active nurturing, where the role of the owner shifts from simple supervision to precise, resource-heavy support. Every meal served is now a calculated step toward ensuring the health of the mother and the viability of the offspring. With the pregnancy established, the focus turns to the delicate internal development now underway. During the first 3 weeks, the kittens undergo the complex process of conception, implantation, and the initial formation of vital organs. This is a period of high vulnerability. Any external pressure on the mother at this stage can have irreversible consequences. Resist the urge to palpate the abdomen to count the litter. The internal structures are far too fragile to withstand manual checking, and any attempt to estimate the number of kittens through touch risks direct injury to both the mother and the developing offspring. Safety requires a hands-off approach. Furthermore, the mother's system is now highly sensitive to external chemical interference. Never administer any medication, supplement, or treatment without explicit veterinary approval. Even common household items can cross the placental barrier and disrupt the delicate growth cycle. Early and consistent veterinary screening is the only responsible way to manage this phase. A professional assessment around the 5th week is the optimal time to track progress and screen for complications, including parasites like fleas or ticks that could drain the mother's resources. Trust the professional, monitor from a distance, and prioritize the integrity of the environment over the curiosity of the count. By the 7th week, the physical reality of the approaching birth becomes undeniable. The mother begins to exhibit distinct nesting behaviors, seeking out quiet, secluded areas. Prepare a birthing box now, lining it with shredded paper or soft blankets to provide a warm, stable environment. When labor begins, the process typically spans 2 to 5 hours. This is the moment where human restraint is tested most severely. Minimal intervention is the rule. Watch from a distance, allowing the mother to lead the process instinctively. She knows the rhythm of the birth better than any observer. As each kitten arrives, the environment must remain calm and undisturbed. Once the delivery concludes, the focus shifts to the immediate survival of the litter. Monitor the newborns closely to ensure they locate the mother and begin to nurse. This is the crucial threshold. If a kitten fails to latch or the mother does not groom them, contact a veterinarian immediately for guidance on potential hand rearing. Watching the kittens successfully nurse is the culmination of the entire journey. It is the sign that the process has proceeded safely. With proper preparation and constant attention to the mother's needs, the wait ends not in uncertainty, but in the arrival of a healthy, thriving litter, marking the start of a new life cycle.